When is a TIPS procedure necessary for liver health? Imagine a tiny highway built inside your liver to help blood flow more smoothly. That's what a transjugular intrahepatic portosystemic shunt, or TIPS, does. It's a special procedure used mainly when liver problems cause dangerous pressure in the blood vessels. This pressure, called portal hypertension, happens often because of severe liver damage like cirrhosis. When the liver gets scarred, blood can't flow normally through it, causing pressure to build up in the portal vein system. This can lead to serious issues like bleeding from enlarged veins, known as varices, or fluid buildup in the belly called ascites. A TIPS is usually considered when these complications become hard to control with standard treatments. For example, if someone keeps bleeding from varices despite medication or endoscopic procedures, a TIPS can help. It works by creating a new pathway inside the liver that connects the portal vein directly to the hepatic vein, which carries blood back to the heart. This bypass reduces the high pressure in the portal system, lowering the risk of bleeding and helping to manage fluid buildup. Another key reason to consider a TIPS is when ascites does not improve with medicines like diuretics or changes in diet. If fluid keeps accumulating and causes discomfort or health risks, a TIPS can help by decreasing the pressure that causes fluid to leak into the abdomen. Doctors also look at other conditions that might benefit from a TIPS, such as bleeding from gastric varices, fluid in the chest from hepatic hydrothorax, or rare issues like blockage of the liver veins, known as Budd-Chiari syndrome. Sometimes, TIPS is used in cases of kidney failure related to liver disease or lung problems caused by liver issues, though these are less common. Before performing a TIPS, doctors carefully evaluate the patient's overall health. They check liver function, do imaging tests to understand the anatomy of the liver and blood vessels, and assess heart and lung health. This helps determine if the procedure is safe and likely to benefit the patient. It's especially important to avoid TIPS in patients with very advanced liver failure, as the risks may outweigh the benefits. In summary, a TIPS procedure is a valuable tool when portal hypertension causes serious and manageable problems like ongoing variceal bleeding or persistent ascites. It can significantly improve quality of life and reduce life-threatening risks, but it's always done after thorough medical evaluation. If you or someone you know faces these issues, it's essential to consult with a healthcare professional who can determine if a TIPS is appropriate based on individual health circumstances.